Well, we've known for 70 years that type 2 diabetes is a simple mineral deficiency. It's not genetic in any way, shape, or form. It can certainly be generational because some families have a gluten intolerance, and that's passed on through cord blood and breast milk and passed on by females to their babies. Boys can get gluten intolerance, but they can't pass it on to their kids because it's not a genetic thing. But it does affect how you absorb nutrients. And if you live in a place which is low in the food and the soil of that particular mineral, when you have a deficiency of that mineral, you get type 2 diabetes, you're going to have a high risk of type 2 diabetes. Well, the nice thing about it is you supplement with what we call the secret sauce, which, of course, is the mineral that's missing. You take that along with the 90. We call it the healthy blood sugar pack. You're going to support and promote healthy blood sugar levels. You're going to support and promote healthy sugar and carbohydrate and fat and protein metabolism at the cellular level. And I want you to get a couple of books. I want you to get a hold of the books called Energy Crisis, and it goes into how we extract energy from proteins and fats and carbohydrates and sugars. Goes into all kinds of sources of calories and energy and so forth, including energy drinks and sports drinks, coffee and tea and their histories and so on. Which sweeteners are natural, which are man-made and synthetic. There's a lot of mistakes out there in the field. People believe that certain ones, for instance, sucralose, people think that's a man-made sweetener, but in fact it's actually just an extract of molasses. So it's all natural. It's just a fraction of molasses, just like diesel fuel is a fraction of crude oil. Okay? And so we go into the degree of sweetness and so forth, as well as compared with table sugar, as well as their histories and how they were discovered and what they're used for and so forth. You're going to want to get that book, Energy Crisis. You also want to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. And epigenetics, of course, is going to go into diabetes, type 2 diabetes, because everybody has been told and taught that type 2 diabetes is genetically transmitted. Of course, it's not. It's a simple deficiency of a single mineral. And then there's type 1 diabetes, which is an inborn error metabolism, which means mama was missing something with the beta cells and the islets of Langerhans and the pancreas, which traditionally produce insulin, are either very few of them there compared to normal. Let's say there's supposed to be 100,000 of those cells per islet of Langerhans to make enough insulin, and you might only have 5 instead of 100,000. You might only have 5. Okay? So you need to have supplemental insulin after you're born. And this is not a genetic thing, but it is an inborn error metabolism. Mama was missing something while those beta cells are forming, and this can occur because she has a gluten intolerance and couldn't absorb the nutrients properly. Could just not have had any of those nutrients in her diet at all. Okay? And so you do want to get hold of the book Energy Crisis. You want to get hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. And, of course, other birth defects are things like cerebral palsy, and there's varying degrees of that, cleft palate, varying degrees of that, congenital deafness, babies are born with spina bifida, club feet, heart defects of all kinds, and then things like Down syndrome, which is actually a deficiency of a single mineral in the first few moments of pregnancy when the sperm fertilizes the egg and you have a zygote, a single-celled human being. And in the first division, when it goes from a single cell to 2 cells, if you don't have those minerals, you're at a high risk to have trisomy, which means you're going to get 3 chromosomes. But it could be any one of the 23 human sets of chromosomes. It doesn't necessarily always have to be trisomy 21, which causes Down syndrome. And, of course, there is a heart defect that commonly goes along with Down syndrome because that same nutritional deficiency causes heart defects, a particular type of heart defect, because that part of the heart is forming at the same time that the early stages of pregnancy. So the two run together. Well, there's other things that run together, including cerebral palsy and homosexual behavior, transgender, those kinds of things. And that's because the preoptic hypothalamus, the part of the brain that drives you to be attracted to certain type of people, male or female, regardless of your genetic gender, right? Regardless of your genetic gender, if you don't have those nutrients, well, that part of the brain, the preoptic hypothalamus is farming, you could be genetically male and be told by that part of the brain, preoptic hypothalamus, to chase males. Okay? Or if you're a female, genetically, that part of the brain could tell you to chase females and you'd be a lesbian. Okay, these things are totally preventable. You have to give the mother, of course, all 90 essential nutrients for 3 to 6 months prior to conception, all through the pregnancy the baby's developed in from the moment they're born. And except for social pressure, that sort of thing, is biologically it's difficult, if not impossible, to direct a homosexual of one persuasion, either a lesbian or a gay guy, to become heterosexual. They might do it for convenience, being able to stay in a house or whatever, but inside they're going to be driven to where that preoptic hypothalamus drives them to go. Okay? And again, it's almost impossible to reverse the procedure after the baby's born, but it's easily prevented. So I urge you, look for this. If we have all kinds of distractions, things like recreational marijuana. Kids are going to spend their money for that rather than vitamins and minerals. So you better be giving vitamins and minerals to your kids before they get married, before they have kids, for presents. Okay? Because that pot is going to cause us problems indirectly. Well, we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, when I saw this one, I immediately thought of you as this Fox News story is headlined, "Think Snoring is Normal? Why sleep apnea shouldn't be ignored." See, people who snore may think that it's only their partners that are affected, but because they're the ones who are kept awake. They say, but snoring can be just as an annoyance, more than an annoyance to anyone else in the room. It can be a symptom of a serious health condition and has been linked to dangers like heart disease. There are many reasons why people snore, and not all of them are chronic or hazardous to your health. You may not even be aware that you're sawing logs. They say in the middle of the night, wheezing, snorting, snuffling can happen for a variety of reasons, but they all have to do with the obstruction in a person's airwaves. Most often the muscles in the back roof of the mouth, soft palate, or the back of the throat relax, partially block the flow of air. According to Ph.D. Michael Gardner, Grandner, professor of psychiatry and a member of the Center for Sleep and Circadian Neurobiology at the University of Pennsylvania's Perelman School of Medicine. He's quoted as saying, if you blow air through a floppy tube, it's going to vibrate and make noise. This can occur when people sleep on their backs instead of their sides, when you've had a few drinks before bed, because alcohol relaxes the muscles, or if they have a nasal condition due to allergies or a cold. In fact, about half of adults snore at least some of the time, according to Gardner. It's usually not dangerous most of the time, as we still get enough air to keep things functioning normally, but other snoring triggers can be harder to fix. For example, if you have an enlarged uvula, a large tongue, or being overweight, especially for men, since they tend to gain weight around their necks. And they say this raises your risk of obstruction and sleep apnea, a condition for which a heart isn't able to get enough oxygen to function properly. They say between 5 and 15% of adults in the middle ages probably suffer from sleep apnea. And if it goes underdiagnosed or undertreated, bad news, studies have shown that it's a strong association between sleep apnea and high blood pressure, high cholesterol, heart attacks, and other cardiovascular conditions. Well, what do you think about that, Doc?
Well, you've heard me say it many, many times over the last 36 years. Sleep apnea is a normal behavior. Sleep apnea occurs when your carbon dioxide levels go down, okay, and there's no stimulus for your body to breathe. And, of course, it can go down for a variety of reasons. And, in fact, the better shape you're in, sometimes your carbon dioxide levels will go down. And so you could be deficient in omega-3 essential fatty acids, okay, and can cause blockages of your airways because you're not producing the hormones that keep your bronchial tubes open. And, again, the article did say you can snore more when you sleep on your back or if you're overweight, so you want to watch those things. But I wouldn't buy the $4,000 machine. I certainly wouldn't get surgery. And I would totally avoid any advice of the doctor who said sleep apnea causes cardiovascular disease. Nope. It's a normal behavior. So what you want to do, of course, is make sure you're going to manage your weight. Remember, being overweight and obese is not genetic. It's not lack of exercise or eating too much. Being overweight and obese is a nutritional deficiency disease. And so what you want to do is take the 90 essential nutrients appropriate for your body weight. We actually have an herbal combination called Sleepies. You could take maybe 1 or 2 of those capsules half hour before bedtime with a glass of water. And you need to be in the bed when you take them because it'll make you drowsy pretty quick. help you sleep. You could also take an extra ounce of the OsteoFX Plus at bedtime with a glass of water. That extra mineral load will help you sleep better and relax everything. And so why would you want to spend tens of thousands of dollars and, put yourself at risk of being damaged by a doctor when you can take care of yourself nutritionally? Because sleep apnea does not cause heart disease. That's all nonsense. But thanks for bringing that one up. Well, stick with us. We'll be back with Dead Doctors Don't Lie and more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Florida. And Ed, you're on with Dr. Wallach.
Oh, Ed, you're on the air.
Yes, sir. You told me to give you a call back in a couple of weeks on my blood pressure. Do you need me to run you through what I'm taking?
No, just tell me whether you've seen improvement or not, and if so, how much, and what's going on?
It hasn't improved any. Yesterday it was 195 over 106.
Okay, and how long? Wait a minute. How long have you been on the program?
Probably about 6 months by now.
Okay, then you have a major absorption problem. Okay, there's only one reason why this won't work, and two reasons. One, you're underdosing severely, and number two, you have an absorption problem. How much do you weigh?
150.
150, okay. And so, I would be taking something like 2 of the Healthy Brain and Heart Packs per month, one full dose of everything twice a day. That would be 3 selenium at breakfast and dinner. It would be 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. All would be accomplished with the 2 Healthy Brain and Heart Packs per month. Then I would also throw in 3 of the Ultimate Daily tablets. But since you've been doing this for 6 months and not seeing anything, I would go in 3 of the Ultimate Daily tablets 3 times a day. That'll be 2 bottles a month of the Ultimate Daily tablets, and they're designed to support and promote healthy blood pressure. They're designed to support and promote healthy blood flow through obstructed arteries. And I have to ask, do you have any other issues like diabetes or kidney disease or arthritis or anything?
They told me when I was in the hospital with congestive heart failure that I had some kidney damage.
Mm-hmm. Okay, well, congestive heart failure is a concern. So I'd throw in one more thing. Because the Ultimate Daily tablets usually supports healthy kidney function. Okay. But I would also throw in the de-stress capsules, 3 of those twice a day. That's 2 bottles a month. And that is certainly for all kinds of everything from congestive heart failure to dementia and so forth, a lot of things. But congestive heart failure is a deficiency of a single vitamin usually. But at any rate, I would get off of gluten, absolutely no wheat, barley, rye, and oats. That includes yourself, spouse, mother-in-law, kids, dog, cat, bird, fish. Anybody living in the household's got to be drop-dead gluten-free. You alone in the house being gluten-free won't work because of cross-contamination in the laundry, the food preparation surfaces, the couch everybody sits to watch TV, the bed you sleep in with your spouse. And so if you've been doing this long, appropriate for your body weight, you have an absorption problem is the only possibility here. So that's what I would do. I'd be really, really working on getting rid of the processed meats with nitrates and nitrites, deli slices, sandwich meats, get rid of the fried foods, get rid of the oils, including olive oil and coconut oil, margarine, mayonnaise, cellulose, and cooking oils, get away from the gluten, no wheat, barley, rye, and oats, and then call me every couple of weeks. Don't wait 6 months. And we'll be back after these messages.
Let's head to Medford, Oregon, and Alan, you're on with Dr. Wallach.
Alan, you're on the air.
Thank you, Dr. Wallach, for taking my call.
Yes, sir. What's up?
I have 2 separate questions. The first one is regarding fibromyalgia. My niece has it, and she would like to eliminate it.
Sure.
And so,
how old is she?
She is 45.
Okay, what does she weigh?
About 260 right now.
Okay. Do you know if she has any other issues, any asthma or skin problems or constipation, diarrhea?
She's had, matter of fact, we noticed it last night. It looked like emphysema on her face and on her arms.
Oh, eczema, you mean?
Eczema, I mean.
Yeah, okay. Yeah, emphysema is a lung thing. So, if she has eczema on her face and her arms, it could also be keratosis, which is kind of a rough, kind of either white or red, little microscopic pimples. This is caused by vitamin A deficiency from malabsorption. In either case, they're both malabsorption problems. Because she weighs 260, ideally she should be taking 3 doses a day of everything I'm going to tell you, okay? And so you have to remember that fibromyalgia is a multiple mineral deficiency disease, as is keratosis, which is these sort of rough things on her face and hands and arms and so forth. Sometimes people get them on their thighs and so on. And so I would go ahead and give her, ideally, now if finances are a problem, you might want to cut it to 2, but ideally she's going to need 3 healthy brain and heart packs per month. That'll be 3 of the selenium at breakfast, lunch, and dinner, 1 ounce of the OsteoFX Plus at breakfast, lunch, and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast, lunch, and dinner, 3 of the EFA Pluses at breakfast, lunch, and dinner, and 3 of the EFAs at breakfast, lunch, and dinner. All that would be accomplished by supplementing with the 3 healthy brain and heart packs per month. Now, even more for this fibromyalgia, she's going to need the glucogel, which is the raw materials to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes bone itself, and skin. And I would throw in 3 bottles a month, 3 large bottles a month of glucogel, so you could have 20 a day. 5 at breakfast, 5 at lunch, 5 at dinner, 5 at bedtime with a glass of water. And let's see here. I would also have her take the ASAP. I'd have her get 2 bottles a month of the ASAP and have her take 1 dropper full, not a drop, but a dropper full underneath her tongue 30 minutes before each meal, and a second dropper full before each meal, 15 minutes before each meal. That's going to require 2 bottles a month of the ASAP. It's designed to accelerate the weight loss deal. But to help her absorb more, she's going to have to get rid of fried foods out of her life, no oils, no processed meats or nitrates and nitrites, and no gluten, no wheat, barley, rye, and oats. No wheat, barley, rye, and oats. And she, her siblings, if she has any children, they all have to get on a gluten-free diet. This means the spouse, the mother-in-law, the dog, the cat, the bird, the fish, anybody living in that house because of cross-contamination on the food preparation surfaces, the couch where everybody watches TV, the bed that she sleeps in with her spouse, and also the laundry. So it's imperative that her life is cleaned up from all these things that's going to interfere with absorption. And people can absorb calories, but they can't absorb nutrients. And that's why people get big when they have absorption. People say, well, I don't have an absorption problem. Look how big I am. Well, that's because they can absorb calories, but they cannot absorb nutrients. We'll be back for your second question, Alan, after these messages. Okay, Doug, let's go right back to Oregon. And Alan, you're on the air.
I am here. Okay, the second question is on a friend of mine's daughter who has something referred to as Arnold-Chiari malformation.
Okay, and, tell me what that malformation is and whether she was born with it or not.
I believe she was born with it.
Okay, and what is it?
Has something to do with her mind, I think. I'm not 100% sure on this here.
Well, anything when somebody says malformation, that kind of infers a congenital event. Mama was missing something during the formation of the embryo, and and so somewhere between the day of conception and the 91st day of pregnancy, which is just a little more than 3 months, the first trimester, if the mother's missing anything, as that baby's going down the assembly line, they're going to get a birth defect. But like I say, when a kid gets a birth defect, such as Down syndrome, very frequently they'll also have a heart defect with it, because the same nutrients, when they're deficient, can result in a heart defect as well as Down syndrome, so it's not unusual for them to run together. Just like there's a much higher rate of homosexuality in kids with cerebral palsy, because the part of the brain that controls who you chase for sex, the preoptic hypothalamus and the cerebellum, which controls your motor movement, which is when it's underdeveloped, you get cerebral palsy. Those two run together because guess what? They both form at the same time. They both require the same nutrients to develop properly. And so what I would want is a list of the defects, because when they say syndrome, it usually means there's multiple defects. And you see this a lot in the Amish community, where they have Yoder's syndrome and that sort of thing, because the families, which are very common in the Amish community, like the Yoders, they have the same 3 or 4 birth defects at the same time, and so they call it a syndrome. And these things usually aren't changeable, but I would want to know exactly what the defects are, because some of them are manageable better than just doing nothing. So find out what they are exactly, and then get back to me, and I'll see what we can do. Okay, Doug, let's go to callers.
All right, let's head to Indiana. And Sylvia, you're on with Dr. Wallach.
Hello, Sylvia, you're on the air.
Hi, Dr. Wallach. I'm so thrilled. This is my first time getting through on the radio.
Okay, well,
but my husband and I have actually seen you a couple of times. We've been in Longevity for about 2 years.
Okay.
We heard you speak in Iowa and Indianapolis.
Sure. How can I help you today?
This stuff really works. I want everyone else that's listening out there to know. My husband had a painful rheumatoid arthritis. He had it since he was 9. That's been reversed. And I've lost 30 pounds without really even trying. I just gave up a lot of breads and pop. And then I had skin tags really bad that have disappeared. I don't know what exactly in the regimen I was taking that has made that happen, but I'm really happy about it. I can wear necklaces and enjoy having it look nice again. My husband recently had a work-related injury, and he avoided surgery and recovered from a seriously torn right quad with your products.
Okay.
We actually talked to Dr. Glidden, and he recommended, he was local and we could get through to him. And so we were able to get information, and my husband has had a really, really good recovery. The reason I'm calling today is I am very upset and very disappointed. I have a beautiful black and white Dutch show buck. He was born on May the 12th, 2014. He's approximately 4.5 pounds. He's about 8 months old. He was fine last Saturday.
Our listeners out there, you're talking about a rabbit.
Yes, I'm sorry.
Male rabbit.
A beautiful show rabbit.
Yeah, okay.
He's black and white, and last Saturday he was fine when I fed him and checked on him and loved on him before I went to bed. He's an inside bunny, by the way, because he is a show bunny. I don't keep him outside with my others. On Sunday, after we came home from church around 2 o'clock, I usually feed us, and then I go take care of my rabbits. And around 2 o'clock, we heard him thumping and thrashing on the cage floor wire. And so we ran down to check on him. It was around 2 o'clock, and discovered that he had damaged both of his eyes. One is badly damaged. The other eye is better now. It was bruised. But he had a tilted neck, and he was violently flopping from one side to another, and he was rolling around on his back. He could not stand at all. Sometimes bunnies will sit and kind of squat. Other times they'll stand. This was nothing I had ever seen before. He was just unrecognizable in his behavior. He couldn't stand. His legs were constantly shaky, whatever side he was laying on. I've been concerned about bed sores because I can't get him to take turns on each side.
Okay, now stop here a minute. So is he eating?
Yes, I have been getting fluids down him, and yes, he has been eating. I took him to a vet here locally, but most vets around here are not familiar with bunnies.
And so what did the vet say?
I'm sorry?
What did the vet say?
The vet told me, I got him in on Monday, and he told me really quick, he gave him a general check. He told me he had an inner ear infection. Then he offered to put him down. And I said, you told me that he had an inner ear infection. I said, you don't kill a child because they have an ear infection. What other options do we have? And then he prescribed an antibiotic called Clavamox. It's a combination of amoxicillin, trihydrate, and clavinudate potassium. And then he told me when he gave it to me, sold it to me, he said it wouldn't work, maybe not work. A rabbit breeder, he only had 6 doses. He was supposed to take 2 doses a day. So that meant on Thursday we were running out. And so a rabbit breeder that has dealt with this before, I could not get through to you on Thursday or Wednesday. So I'm frustrated, but I'm trying to reach out to anyone who might have information. Sure. A friend of mine suggested that we start him on penicillin G.
Yeah. Okay. Well, I'm not real excited about an ear infection. Okay. I missed that first part when you said there was something about the wire. Did he get caught in the wire or something?
No, he was thrashing. He was laying in his cage.
Oh, so you heard him. Okay, you heard him downstairs thrashing around the cage.
Yes, yes. And
okay. But he was okay when you went to bed, and then sometime in the middle of the night he's thrashing around.
No. It was Saturday night. He was fine. We went to church Sunday morning, which I normally check on him before church, but we had to be there extra early. My husband did check on him, though, and he was fine then. We came back from church. We ate brunch or whatever, and we went down to check on him, and about that time, it was around 2 o'clock, and my husband heard him first, and he was just thrashing.
Okay, let's stop. And I'm assuming you're feeding him the alfalfa pellets for rabbits, and one of the commercial brands, correct?
Yes, Country Roads, and it's supposed to
now anything's possible. Some of that stuff could be wet or wet bedding or something, get a little mold growing. There are toxins, things like things like botulism toxin, all kinds of stuff. I'd bet more on that kind of thing. And the only thing that's going to work here is good nursing care to see if this rabbit's going to survive. You just keep feeding them, throw in the plant minerals, throw in the Beyond Tangerine and the EFA Pluses, and call me in 2 weeks. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. And if you're going to do the longevity business as a business, I urge you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, and learn how to deal with over 900 different diseases using vitamins, minerals, and trace minerals, and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. It's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. Okay, Doug, let's go to callers, emails, or faxes.
Let's head to Raleigh, North Carolina, and William, you're on with Dr. Wallach.
Well, William, you're on the air.
Yes, thanks, Doc. This was a young lady about 2 weeks ago.
Okay.
She went to the hospital. She went to the emergency room. She was having a problem with her heart, and she was having a problem breathing. And so when they took her, and when they said they found out what the problem was, they said that she had fluid on her lungs, and they were swollen, and she was having a problem breathing.
Okay.
So they did that, and then they put her on a blood thinner and oxygen. So.
Yep. Did they give her any water pills, to get rid of that fluid? How much does she weigh? How much does she weigh, William? Is she a big girl or small?
Right at 300 pounds.
Okay. All right. Well, at 300 pounds, again, ideally, she needs 3 of everything per day, right? And so we're going to deal with the heart. We're going to deal with the lungs. What I'd like her to do is take 3 healthy brain and heart packs per month. If that's financially burdensome, don't let her get any lower than 2. But ideally, she would take 3 healthy brain and heart packs per month. That's 3 of our Ultimate Selenium at breakfast, lunch, and dinner, 1 ounce of the OsteoFX Plus at breakfast, lunch, and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast, lunch, and dinner, 3 of the EFA Pluses at breakfast, lunch, and dinner, 3 of the EFAs at breakfast, lunch, and dinner, all that be accomplished by the 3 healthy brain and heart packs per month. I would also give her the de-stress capsules. I want her to have 12 of those a day, 4 at breakfast, 4 at lunch, 4 at dinner. That'd be 3 bottles a month of the de-stress capsules. And I want her to have 12 a day of the Ultimate Daily Tablets. That's for congestive heart failure. That's for efficiency of fluid going in and out of the heart and the blood and the lungs. We got to take care of all that. And so I want her to have 12 of the Ultimate Daily tablets a day, 4 at breakfast, 4 at lunch, 4 at dinner. That's 3 bottles a month of the Ultimate Daily tablets. And this is going to support and promote healthy blood pressure. It's going to support and promote healthy blood flow through obstructed arteries. And then lastly, I want her to have 2 bottles a month of the ASAP. So you can take a dropper full, not a drop, but a dropper full under her tongue 30 minutes before each meal, and a second dropper full 15 minutes before each meal. So that's going to take 2 bottles a month to pull that off. And after a couple of days, she'll start losing anywhere from a half a pound to 2 pounds a day. And, of course, what you're looking at is the magic here. She'll never gain the weight back as long as she stays on the supplement program, because when you're overweight and obese, this is due to nutritional deficiencies, not lack of exercise or eating too much. How much is this lady? How tall is she, you think, William?
About 5'4".
5'4", okay. Yeah, I'd like to see her weigh 140 pounds, so she needs to lose 160 pounds. And she could do that safely within 4 to 6 months using this program. And then, of course, she has to stay on 2 of everything instead of 3 of everything here, just for maintenance. She's in trouble. And, of course, she's got life-threatening events here. Anytime you have fluid filling up your lungs, can't breathe, you can drown in your own juice, as they say. Heart disease, this is not good because you can't work without the heart. And so she really needs to jump on this. And unfortunately, there's no nutrition in blood thinners. And I really, really get upset with the doctors because they forget that the reason why people are in this kind of trouble is because they're eating bad things, fried foods, processed meats, oils, things like olive oil, coconut oil, margarine, mayonnaise, cooking oils, and gluten, wheat, brown, and oats. Got to give all those up so she can maximize her absorption of the nutrients. And if she has children, they've got to do the same thing. They got to get gluten-free and take the 90, appropriate for their weight. If she has siblings, brothers and sisters, they got to do the same thing. Give us a call every couple of weeks, William. Let us know how this lady's doing. Well, thank you, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.